So for the referring provider, we actually developed what we refer to as the easy button.
Well, hey, Rick, welcome to the show. How are you?
I'm doing wonderful. Thank you for having me.
Yeah, thanks for coming on. I'm excited about talking about healthcare data and kind of how it's siloed in the healthcare industry. But before we dive into that, tell us a little bit about yourself, your background, and kind of what brought you to what you're doing now with Arrow.
Yeah, absolutely, Rafi. Thanks for the opportunity to share. There's a common theme with everyone on the team. It's not just limited to the co-founders. We all are trying to fix some area of healthcare for a family member, and that's no different for me. So I wish I could say we saw some magic niche in the market 7.5 years ago that nobody else saw. But really, our motivation and mine in particular stemmed from a personal need. So, I grew up with two parents who worked for opposing health systems, and
Okay.
my dad was a rec therapist. My mom was a pediatric psychologist, and the moment my father became truly a complex patient, he was diagnosed with Parkinson's. For the first time in our lives, we realized just how difficult it is to truly move his information around. He went from being a pretty simple patient over the course of his life and receiving most of his care under, sort of one umbrella. And when that changed and his care team expanded further out into the community and then regionally and nationally, um, it was really painful to move just simple things like
Yeah.
medical records, MRIs, CT scans. And so for me, it really stemmed from a trip I took with him out east for a Parkinson's specialty trip. That the short of the story was he had a CT scan done in his hometown, and it was mailed to a health system, which was like throwing that DVD down a black hole.
Yeah.
And the physical symptoms of Parkinson's, can are very visible and be traumatic and are highly tied into anxiety. And to say that when my dad found out we needed to extend our stay for another day that wasn't planned, and he needed another dose of radiology, and without an appointment, we had to sit in a radiology waiting room at a health system for the better part of a day. I
Oof,
just
yeah.
watched him kind of fall apart. And that was the moment where I started shopping as a consumer, to try to find something that would make it easier to move his health information around. And I had the privilege of working for a healthcare technology company that had a really aggressive data acquisition stance, and a great business model in a B2B environment, but really offered nothing at a patient level. And so spent a period of time shopping for a solution. Most of it, I was uniquely positioned to identify that it was vaporware. And those that felt real had sort of an impossible business model, where we'd have to get independent physicians plus hospital employed physicians to sign up for a service and pay for it. It just really wouldn't gain traction. So, at the risk of going a little bit deeper than I had planned, it's highly personal, and that was the motivation for myself. Um, just sort of the only way we're going to get to a spot where perhaps we can really make it easier for care teams to collaborate and share information is if we build a solution that works within the existing ecosystem. And that's true for my fellow co-founders. Dave, he had a similar challenge for his sister, and Scott for his brother. And we can go down the list of team
Yeah.
members, everybody, right? So.
Yeah. So, I guess without getting too into the weeds, like high level, what does Arrow Health do? Because it obviously we're talking about getting information from like one provider to another, or from a health system to maybe a private provider out in the community. Like what is the main function, I guess, that of Arrow Health?
Yeah, our core focus is enabling frictionless referrals from one
Okay.
provider to the other, and sharing information back about that patient's journey, um, once they receive care from the provider who received the referral.
Yeah. So I guess it kind of opens up a little bit of because this happens, I'm sure, all over the place, not just in my clinic, but we'll get like a fax from like this doctor's office, and they're like, "Oh, so can you give us the update on Rafi, who we sent a referral on 3 months ago?" And it's like, "Well, we sent you the plan of care, 2 days after the thing was done, and it went into a black hole somewhere." So it's helping solve that, right? Like it's connecting the pieces of all this like disparate data points or encounters, and kind of giving both parties kind of just a clear view of the patient's journey for this one particular referral, right?
It's 100% right. You nailed it, and so that progress note or consult note
Yeah.
would be easily accessible from within the native workflow, typically the EHR for the referring provider. And we simplify it to the point that they're securely logged in, have full access to that note. In most cases, have access to your information, even your mobile phone if you want to have a live conversation, schedule history. Yeah, just complete visibility without having to log into
A different
another
system or a
platform.
different portal.
Yeah.
Yeah. All right. Well, then let's back up a little bit, because you kind of touched at the very beginning about how like it's a pain sometimes to get information from one provider to another, from one system to another. So I think that's pretty clear, like how that's an issue. Obviously, like this siloed healthcare data ecosystem that we find ourselves in clearly affects patients when they're trying to go from, San Francisco to New York, or, even from like Atlanta, Georgia to Columbia, South Carolina, or something like that. Like the ability to get your information from providers that you saw in one location to another is a challenge. And obviously that affects patients, but like, how does this siloed data system in which we find ourselves, or the environment in which we find ourselves, affect providers and payers? And I'm imagining both of them have, their stakeholders in this, and they'd like to have some some clarity too, right?
Absolutely, absolutely. So I'll sort of start at the beginning. Our approach has a common theme. It's patient centered, but it's also meet end users or care team
Yeah.
members where they are, without creating a new workflow, a new platform to log in, adopt where they're already doing their day to day work. So for the referring provider, we actually developed what we refer to as the easy button. And it slides right alongside and lives, in harmony alongside the EHR that they're working out of. So we've sort of modernized and extended the browser, if you will. So providers that are working on, day-to-day treatment with patients in a modern browser-based EHR, we use an extension as the vehicle to implement our easy button. And so that extension can be downloaded via Chrome, Microsoft Edge. It takes a few minutes to download it. And the referring app, the easy button for provider groups like yours, so it could be that I'm a primary care doc and I'm referring a patient for physical therapy. Rafi, your easy button would appear on their browser as they navigate their way throughout the patient intake and encounter. The patient presents is a viable candidate for physical therapy and would benefit from PT. The easy button would illuminate on the side of the screen, and the provider would simply, have a conversation with the patient about it and hit the refer button. No need to do double data entry, no need to print out a form, fill it out, or e-fax a form. They don't, a lot of ways the feedback we get from providers is we've eradicated the swivel chair. So they're not moving from one tab to the other to go onto a website and fill out the referral form. We've simply published all that data from the EHR directly into the referral. They hit send, and the recipient of it gets that information in the format that they need to engage in outreach and scheduling for the patient.
Yeah, that's awesome. Okay. That's a very clear view of how that helps. So what are some of the big challenges involved in this? Because I'm assuming you're talking, like APIs and this, that, and the other, and no one can integrate with any EMR. So like, what are the big challenges involved in sharing healthcare data among maybe different provider organizations, maybe it's a policy thing or a tech thing? Like, kind of what are the big roadblocks or speed bumps you have to go through when you're trying to put something like this together?
Yeah, again, that theme of meeting the end user where they're at. Traditionally in healthcare, integration is in terms of sort of outdated back end integration,
Yeah.
or heavy lifts and coordinating with your EHR company or your third party IT company, and then sort of delving through the fine print and finding out that there could be an unexpected cost or certainly wait times to create just a simple path of communication from one EHR to another to a CRM. Our approach is unique in that we do not rely on any traditional back end integration. So all of our resources went towards integrating directly with Google for Chrome and Microsoft for Edge. We use extensions in our day to day outside of healthcare,
Yeah.
all the time. And so it's a secure vehicle for us to implement our proprietary technology in a way that requires no heavy lift, no hidden costs, no coordination with third-party IT companies and EHR vendors. And does this EHR vendor play nicely with the other one? It's irrelevant. It's not a consideration. And so in this case, the end user can simply install the easy button from the Google Play Store. It downloads. They're asked to authenticate once, and they're up and going. And for larger provider organizations, maybe risk-bearing entities like clinically integrated networks, ACOs, we meet them where they're at. Their IT and security folks are able to whitelist our extension and push it out to every end user. They log in the morning, and they're securely logged into your easy button application. So really simple, can be installed in a matter of minutes or within 24 hours, and really opens up the referral path between providers.
Yeah. And I guess from a workflow perspective, I mean, like a lot of times the challenge in integrating anything or getting any new kind of tech or tool or solution involved in healthcare or the process of care is like, how does this fit in the workflow? And it seems like it solves a lot of those problems, because it's not like, okay, I need to go log into another system or I need to go fill out this other form. It's right there. It's the easy button or whatever. How easy is it, or have you noticed like administrative and clinical staff or clerical staff when they're putting in these referrals? Like, does it take a whole lot of extra training, or like, can this be handled in a memo? Like, what are kind of best practices for, okay, we're going to implement something new, like it is, regardless of how easy it is, it's a new process for how we do, cardiology referrals or whatever it is. Like, what are the best practices for getting a team on board about it, or getting that system working so that everybody kind of benefits from it?
Yeah, I love that question, because it's a relatively simple answer to pair with a simple
Yeah.
solution. So our easy button, Arrow Health's easy button, is inherently white labeled for the provider who's receiving the referral, right? And so their relationships with their referral networks remain whole. They remain theirs. We are not additive. We don't come in between. We really sort of fade into the background and promote their quality, their brand, their logo. Okay, all that being said, once the end user downloads the extension, or their IT team, pushes it out for them, they don't even need to log into this application. So, we have sort of our value prop. We offer a few things right out of the box. One, when the end user logs into their EHR, they are securely logged into the easy button application. So no second login. Secondly, we're not creating a new workflow or a path for them to do double data entry from data that already exists in the EHR into this referral queue. We're not requiring them to copy and paste, and we certainly are not requiring them to figure out a new workflow that is foreign or different to their day-to-day workflow in the EHR. So that was sort of a long-winded way of saying If a patient is a good candidate and matches the program inclusion criteria for both the referring provider and the recipient of the referral, we just illuminate an application on the right. It blinks. They click it open. It's a prompt to have a conversation with the patient. The recipient of the referral has an opportunity to sort of have an opportunity to share with that provider in that moment of care what their program is about. That's it. So they can simply click the refer button. We package up the patient's insurance, demographic, diagnosis, everything that's needed for the
Yeah.
referral, and it just goes over. So there's no user manual. There's no training
Yeah.
video. There's no install guide. It's it's really there's no 1-800 number. There's no ticket for the end user. It will be there when you need it, and when you don't, it just sort of remains opaque and off to the side.
Yeah, that's awesome. So I guess like let's make this full circle then. So going back to like a situation, like you said, where you maybe somebody's a complex medical patient, they're seeing their PCP or whatever, their PCP has decided to use a solution like Arrow, or maybe some of the community providers are doing that. How does that change the experience for people and patients like your dad, for example, when it comes to going and getting a new MRI or going and doing something else? Like how does like tangibly what changes for the patient?
Great question. Oftentimes, I draw this back to my own family members.
Yeah,
So, even a complex patient like my father, while he has several care team members, the frequency in which he sees his physical therapist, his dietitian, and his pharmacist, those are weekly,
yeah,
if not daily, right? But his PCP is a couple times a year, and his neurologist is once a quarter. So, the most common sort of workflow would be, he gets referred for physical therapy, and it's as simple as his physical therapist receiving all the information that they need to schedule him, do an eligibility status, make sure his benefits are correct, and schedule him. And so for a patient, there's no delay, right?
yeah,
Because somebody like my father, maybe better position, my mother, is going to leave the appointment and go, Phil, you have a physical therapy, you've got a physical therapy plan. And then how quickly can we get in and when can you get started? I think that's a big question in patients' mind. They
yeah,
leave the doctor's office and they're ready to go. And then, the worst thing that can happen is it's just quiet.
yeah.
And
It
so
takes 2 weeks to get a call back or something.
exactly. And maybe the patient has a note or a flyer or a card of the physical therapy group, and they call the physical therapy group and they are excited and they take down all the information. Um, and then they start the outreach to the primary care doc. And maybe it takes a while for them to get back. And so you just start building in these days before a patient can really engage. And so I think for the patient, um, they sort of have peace of mind when they leave the provider's office. The provider's had that conversation with them. They know they've just been referred to a specific physical therapist. Their information is there. And in the best case scenarios with our clients, we see outreach from the recipient of that referral, oftentimes before they even get to their car. They
Yeah.
may have a setup with their CRM where they have an automated text go out and it's quickly coupled with a follow up call and they get scheduled, almost immediately.
Yeah, that's awesome. Um, and then I guess from a like they're seeing the PCP, once a month or whatever. The PCP then is able to kind of get a window into their care and all these different referrals they put out. So by the time the patient is sitting there with the PCP, there's not a whole lot of, well, what have you been doing in therapy or like how have things been going? It's like they can see it right there, right? They can just pull the, click that button and kind of see the flow, right?
That's exactly right. So, for the providers who have the benefit of doing chart prep,
Yeah,
or, there are all the progress notes.
yeah,
They can take their time, they can skim through them, but they see exactly what's happened. And, just opening up a direct lane of communication between providers. I think I was naive to think that providers didn't get on the phone and just talk things out. And when it's, out of sight, out of mind, oftentimes I think it would be difficult for a provider to, probe with a patient like my father to find out how is physical therapy really going. The
Yeah.
patient is generally going to have one or two answers, either like,
Yeah.
"Oh, it's going great," maybe it is, maybe it's not, or I stopped going. How would they? Or it wasn't a benefit. I stopped going. Well, they
Yeah.
would know that, and there's an opportunity for providers to coordinate and really be supportive of a patient completing their care plan. So.
Yeah. Yeah, that's awesome. I'm trying to think of like other ways that tools like this can be used. I was chatting with somebody the other day about like, obviously it's easier to get, referring providers and patients or clinics receiving referrals to kind of get on board with something like this because the benefit is really tangible. But like the idea of like a patient, almost like a health dashboard or something like that, seems like it would be ideal too down the line. Like if I could log into my, Rafi Salazar's profile and be like, oh, I'm pulling data from all these other places. Like, it's just fun. It's fun to think about technology like this and how it like really has the potential to really impact, every stakeholder in healthcare that's involved in either paying for or receiving or delivering care. Like it just seems like there's a pretty wide use case for something like this, right?
Absolutely. I mean, I think that's reflected in our current and growing client base
Yeah.
today. I feel a little silly telling you as a provider the obvious connections between, diet and physical therapy and behavioral health and, cardiovascular health. I
Yeah.
mean, all of these things are connected. And so when we look at our client base, clients being provider groups, healthcare technology companies, healthcare service enablement groups, everybody's centered in sort of rallying around the patient, right? So the patient is always at the center of the
Yeah.
work that's being done. And what really stood out to me in this journey is for a period of time, we actually started and ran a remote patient monitoring company. And it really got us much closer to the patient experience. It got us closer to, sharing information, patient data, but it also exposed where the friction points and sort of the
Yeah.
warts are, right? And so today, when I look at our client base, when we were running a remote patient monitoring company, we would do these, month end or quarter end look backs, and we would see all these patients who on paper qualified for the program, but weren't referred in. And we tried all kinds of measures to correct that. Was it performance based? Was it quality? Were the patients actually benefiting? Was it out of sight, out of mind for the providers and staff? Did they have competing interests? Was it another vendor? But oftentimes, more than not, the provider has such limited time with the patient, and they're really trying very hard to engage with you as a patient. And there are varying opinions about whether or not the tablet or the computer or the EHR is a distraction. I won't go down that rabbit
Yeah.
hole. But outside of that, you've got these different care management vendor partners and food as medicine partners and behavioral health partners and physical therapy partners and cardiology and oncology. And they've got marketing and reps and white papers. And at the end of the day, when somebody like my dad is presenting, you're just kind of focusing in how is Phil now? How am I gonna help him navigate this? How is he gonna feel better? He's really complex. You're not looking at he qualifies for medically tailored meals.
Yeah.
So with the Parkinson's, there's depression, anxiety. He would benefit from behavioral health, and many of these services, if not all of them, are covered by his insurance. Well, just sort of keeping that top of mind, let alone
Yeah.
the vendor partners that you bought off on, that's the program, that's the vendor partner you want to work with. It's really hard to kind of keep that in mind while you're working with the patient. So what really has stood out to me is the ability for us to just remove some of that static,
Yeah.
use the intelligence that the provider and the partner have agreed upon that would be beneficial for the patient, and just in that moment of care, illuminate that opportunity.
Yeah.
Just take some of that thought out of it, identify the patient as a match for a program that everyone's sort of stacked hands on, if you will,
Yeah.
and then give the opportunity for that patient to engage in that care. And we see it every day with medically tailored meals and behavioral health programs and a range of specialty referral programs.
Yeah, that's awesome. Well, we're getting here near the bottom of the hour here. I always um, end with this. If there are one or two main takeaways you'd want a listener to walk away with from the episode, maybe about healthcare data, sharing it, or whatever, what would they be?
A couple of things are very top of mind. One, if you're a provider group that is struggling with receiving high quality referrals and your front desk staff is really feeling the weight of managing emails, phone calls, faxes, secure messages, and sort of living in spreadsheets,
Yeah.
we believe we're a game changer. Our clients tell us we're the silver bullet. We can really automate that for you and create a easy to use referral button and really sort of take away a lot of that challenge. Secondly, to that point, if you have buy-in for your strategic partner, say care management, and you are struggling with adoption and utilization of your program within your provider base, we would be an excellent option to be able to illuminate your value prop when the provider has many other competing interests when they're with the patient.
Yeah. I like that word, illuminate. That's good.
Yeah, yeah.
Awesome. Well, Rick, thanks so much. If people want to learn more about you, about Arrow Health, about what you're doing, where can they do that?
Yep. They can visit our website at arrowhealth.io, and also on our LinkedIn page. We have content that's coming out over the course of the next couple of weeks. But that'd be either one of those places would be a good spot to check us out.
Awesome. Cool deal. Well, we'll link to that in the show notes as well. So, Rick, thanks so much.
Thank you, Rafi.